Commissioner of Health will be joining us in just a moment. She's taking a phone call from her office back in St. Paul. She should be joining us shortly. Good morning. I'm Governor Tim Pawlenty. Joining me this morning are area legislators, as well as the mayors, as well as the superintendent of schools and public health officials, law enforcement officials, and others from the surrounding community. We just finished a meeting providing an update regarding the status of the H1N1 novel virus being confirmed in Minnesota, the first confirmed case. We had a chance to visit about the next steps in terms of the school closure, in terms of some of the steps that the community health professionals will be taking in this area and the state more broadly. And let me just start by saying this. We now have, of course, the first confirmed case of H1N1 virus in Minnesota. We know that that is a case that involves a person in this area. So the Department of Health is continuing in its investigation to determine the source of that virus, as well as the field of others who may have been infected by this virus. We know from the CDC that the general infection period for this virus is 1 day before somebody experiences symptoms and approximately 7 days after they experience symptoms, for a total of 8 days or so. That is the infectious period. So we want to, first of all, announce and confirm that there is the first confirmed case in Minnesota of this virus. This will now trigger a series of steps that the school and the community and the state will take in response to that development. Most notably, this will, under CDC guidelines, result in the middle school being closed for 7 days. That begins to run from the date of the confirmed or probable case, which would be yesterday, Wednesday. So the school will be closed for 7 days from yesterday. We have spoken to the superintendent. He concurs with, in fact, is making that decision. You'll hear from Superintendent Staska in just a moment. We will also be taking a number of other measures, but principally focusing on the investigation in this area to determine the source and as well as the range or array of impact in this community. We also want to again remind Minnesotans, this is a situation that is a cause for concern, but it is not a cause for panic. The World Health Organization continues to raise the level of classification towards pandemic. That is a geographic term that involves the scope of the presence of the virus in various countries and various geography across the globe. But in addition to that, there's also a severity index. And in the United States, most of the cases are behaving as if, or the people who are impacted by this virus are having symptoms that are similar to seasonal flu disorder. And so it is a cause for concern, but it is not a cause for panic. Our goal here is to do everything that we can to try to contain and minimize the chances that this will spread in Minnesota. But realistically, we have to acknowledge that we should expect more cases. We will try to minimize the number of cases. We will try to do everything we can to contain the number of cases. But based on what we know about this virus, it is likely that there will be more cases. We want to remind everyone to practice good hygiene. Wash your hands as frequently as possible. If soap and water isn't available, use Purell or a similar hand sanitizer product. If you are sick, and please stay home. It is going to hamper our abilities to contain and minimize the spread of this virus if Minnesotans do not follow that common sense advice. If you must go out, please avoid contained spaces if you are sick. That will help us minimize the chance of transference or transmission. We realize that that will not be a perfect option for many people, including the sick, but as much as possible we need to encourage the perspective that if you are sick, please stay home or try to minimize your interactions with others as best as you possibly can under the circumstances that you have. I want to turn it over to Dr. Magnan, who will give us a further update on the health side. Superintendent Staska will make some comments about the school closing issue, and then we'll take your questions. Superintendent, or Dr. Magnan.
Good morning. I'm sorry I was late coming in, but I had to go to the restroom, and I was washing my hands and singing happy birthday twice. No, I didn't sing. I counted 20 seconds of washing. But that's an important reminder. We need to give ourselves permission and time to do the good health hygiene that the governor talked about. I wanted to just let you know that one confirmed case that is from your area is out of over 100 that we have tested so far at the Department of Health. We have about 50 more specimens. Okay, these are specimens that are sent in from providers across the state to test. I just was on the phone with the epidemiologist trying to see, people have asked how many of those 50 are from this area. And there's probably about 10 more specimens from this area to be tested. You've already had other ones that have been tested and tested as negative. There's only been one that's been confirmed. But that's from a broad area. It's Stearns County, Anoka area, so it's a broad kind of regional area in here. But that's the latest update on the specimens that are being tested here. If we get another probable one, then we would send that to CDC at this time. We're hoping that we will have the reagents and the procedures and the protocol to actually be able to do that testing by the end of the week or the first of next week at the Minnesota Department of Health, so we don't have this lag in having to send it to the CDC. But as the governor said, you can expect that there will be more cases. And that's not unusual. We're still in the end of the flu season here. And what we don't know is whether this novel influenza is going to just die out on its own. It's just an end at the end of the flu season. Whether it's going to actually escalate into a pandemic and spread more. Or whether we will actually have, as what happened in 1918, where there's a mild phase, and then subsequently 3 to 4 months later, you have a more severe phase. Just want to remind you that flu is unpredictable. It changes. That's why you have to get a flu vaccine every year, because the virus changes, and that's what makes it so unique here, is how rapidly it can change and how unpredictable. And I think if some of you saw Mike Osterholm, he's well known nationally and locally as an epidemiologist. He said if someone can predict for you what's going to happen next, they're dead wrong, and you shouldn't trust them. This is the unpredictability of the influenza. But the good news is that we are ready. We are ready as a state, and you are ready as a region. At 2 a.m., when I called your director of local public health, Renee Frowndes, and I called her and said, Renee, we've got the first case, and it's in your area, she was ready. She knew exactly what she was going to do. She had an emergency team, management team. She said, I'm going in right now and pulling them together, and you saw in coordination with the superintendent and with the other people in this area the effective response that you had. And this is how Minnesota is ready. You are an example of showing how you're ready to deal with questions. You've got a hotline up. You've got a way for people who don't have insurance to get the medical services they need. So you are setting an example of how Minnesotans are ready for this. One of the things to know is that as the governor talked, we have the World Health Organization that is kind of giving us the pandemic levels. We're at stage 5 now. There's another measurement called the severity, and severity is according to death. And as you know, we've only had 1 death in the United States so far that's been reported for this novel influenza. So severity is at level 1 now. And so that we will have to monitor as it goes on. But those are kind of the 2 different numbering systems that you will hear as things proceed. So I think to emphasize, you can expect more cases. We are prepared for how to deal with this, and people need to know the things they can do right now that will modulate, that will mitigate what happens with that severity and what happens with the spread. And that is to wash hands with soap and water, sing happy birthday twice while you're washing to be really effective, and really work with children on this. Children often run their hands under the water and really don't get it. Cover your cough with tissues, so having lots of Kleenex boxes around and places to throw them, or coughing into your sleeves. So cover your cough and sneezing. Staying home if you're ill. Employers figuring out ways that employees can stay at home if they're ill, and sending them home if they come to work if they're ill, and for people to take care of themselves. Don't touch your nose and your mouth and your eyes with hands. That's the way germs spread. That's the way this influenza can spread. And then just basic, what does your mom say? Get a good night's sleep, eat your fruits and vegetables, take care of yourself, have regular physical activity. Those are things that Minnesotans can do right now that will have a huge impact on how this influenza spreads.
Okay. Thank you, Governor. I certainly am not a medical expert or expert, and so in terms of looking at the issue of what we do as a Rocori School District, I rely very heavily on the input that we receive from the Department of Health and from the Governor's office. As we've had conversations this morning about our situation, obviously we do have a confirmed case in the Rocori District. My understanding in following the information from the Department of Health is that it is very much confined at this point in time to our middle school setting. And so as we've operated yesterday and today, we've had our other buildings open. We have had our middle school site closed down, and that's the process that is recommended by the Center for Disease Control. That's a process that's recommended by the state of Minnesota, and that is a process that we will use as a district in the next few days. Obviously, there are things that will happen over the next few days that will help us learn a great deal more about what our next steps should be. But at this point in time, we plan to continue the same pattern that we have today. That is, the Rocori Middle School will be closed through next Tuesday. The next few days will be very important for us in gathering information. It's my understanding from the Department of Health that at work right now, even as we speak, there's research going on and investigation going on into this situation, that we start with the individual involved and work in what have been referred to as concentric circles and work our way out from those that are most likely to be affected to those that have the least effect on this situation. And the department is working through those circles to define how widespread the issue is. That information for us as a district is going to be very critical over the next few days, because that determines our next steps beyond the action that we're taking to close the middle school. Hopefully, as our parents, as our students, as our families cooperate with the Department of Health, there is a request out there by the department right now that if you are contacted by the Department of Health, officials that can be identified, officials that can be, their credentials can be traced. I know that people in our community are a little bit skeptical of talking because, quite frankly, they're afraid of you as media, and they're afraid that the calls that they're getting are somebody trying to trick them into an answer or explaining information. But we want them to know that the Department of Health is making contact with individuals. The Department of Health is working through those concentric circles. The people that are most directly involved are being contacted, and it is appropriate and acceptable, and we encourage you to work with the Department of Health to determine how widespread our situation is. Again, the information that we know right now is that it is confined to our middle school, and the circle is within the middle school setting. We don't have at this point any concern beyond that to the elementary levels or the high school levels. It is simply a middle school exposure that we are concerned about. And so because of that, we again will not have school at the middle school through next Tuesday. If nothing changes, we would open the middle school on Wednesday and operate as normal from there on out, but the next few days are critical to that. Just as we conclude as well, the one request that we would have as a school district, we're not really used to this many media folks on campus. We would ask that as you move from here, we do have school in session. We do have students operating. Out of respect to the students and the staff of our district, we're asking that if you would cooperate and move off campus for us, it sure would help us with our actions with students and staff and allow us to conduct school as regularly as possible. Thank you. We're happy to take your questions.
Is this first case in a child or an adult?
Because of medical privacy issues and laws, we can't disclose that.
Governor, do you know how, what period of time this person was in the school and contagious? Was it the full 8 days, or was it a couple of days of the 8?
We do know that, Eric, and in general, we have that determined, and it's also been relatively good news in terms of the fact that there was a weekend involved and some other things. But again, because of the way that the federal and state laws are structured around medical privacy, we can't get into the details of that.
But you can talk a little bit about when the student came down, when the test was sent into, when the sample was taken, and, talk a little bit more about that, a little bit more timeline on that.
Well, first of all, we refer to the individual as a person because it's your question says student. It may not be a student. So I'll defer to Sanne on the timeline of it. But again, we would tell you if we could, but the laws limit us as to what we can say. But we can give you at least a general timeline.
The specimen came in to the Department of Health on the 28th. It was tested on the 28th and found to be probable. And that at that time it was sent to the CDC. And it was flown down overnight, so that was into Wednesday morning, but it was flown down to CDC, and we received the phone call from CDC very early this morning with the result was a confirmed H1N1 novel influenza.
So the sample was taken on the 28th, too, by a physician?
Right, by a provider. Well, I don't know that for certain. I know that we received it, but people have been sending them in pretty quickly, and they're not waiting on these for holding.
Dr. Magnan, Dr. Mansfield, this is someone who hadn't been in Mexico but had been in contact with which implies, and correct me if I'm wrong, the death rate, the other person may have been a carrier or has infected themselves. Can you be a carrier of this virus without getting sick, or is it to imply that someone else is sick?
Well, that's part of our investigation, trying to do these concentric circles to try to track down and figure out what is really going on with this. This is, by definition, novel influenza. This is new, and therefore we don't know a lot about how this acts. So, in essence, this investigation that we're doing here is crucial to understanding how this virus operates. But typically with influenza, you can have it and be infectious, a day, 24 hours before you have any symptoms. So you can be spreading it and not have any symptoms yourself. And then typically with influenza, you are infectious for 7 days after you have it, after you come down with symptoms. That's what we're saying for novel. Certainly other influenza can act somewhat differently.
The Rocori Middle School is staying closed for another week, but St. Boniface, will it stay closed for another week as well?
Sister, where's the sister? Yes. We've been in contact with the sister, obviously providing her with the same information. The middle school and St. Boniface have been acting in parallel on these matters. I think she's in concurrence with the plan, but the investigation may a different level of interaction or exposure for St. Boniface and the middle school, and if that's the case, we may take a little different path with that, but we don't have enough information yet to make that determination or to advise the sister on that. But, Sister, why don't you share your thoughts as well?
Very well said, Governor. I'm going to be meeting with my board this afternoon, and we will be making a determination as to what the next steps will be, and we plan to notify our parents later today as to what that plan will be. Thank you.
I mean all activities for the students for the next 5 days after school activities, everything's canceled.
Well, again, we're talking middle school only, and so yes, that would include all. If we don't have students and staff here at the middle school, all of the middle school activities would be canceled through Tuesday as well. Yes.
Everybody asked you about the students. So you close the school, but are those students to stay home and not participate in any other? Going to the high school basketball game, or going to their sister's concert at the high school, or staying off the playground.
I think we've heard very clearly from the Department of Health and from that people should take general safety precautions. If you are not feeling well, if you are ill, we would encourage you to stay home. If you're feeling well and you're not ill, there's, to the best of my knowledge, there's no reason not to be involved in things. So. Again, it's if people are feeling ill that they should stay home.
Are there any recommendations for other area middle schools that may have
teachers, staff that was in contact with?
Again, to the best of our knowledge, everything is confined to our middle school setting, and so to the best of my knowledge, there's not a reason to be concerned beyond our middle school building.
On that issue, the CDC guidelines are if you have a confirmed or probable case, then you close the school for 7 days. And so for schools who do not have a confirmed or probable case, that guideline wouldn't apply, and the Department of Health is recommending that they remain open unless they have a confirmed or probable case.
How can you be so sure that it did not a high school or any other?
We can't be sure of that. What we know is based on the information we have now, we have one confirmed case. It is involving a person connected to the middle school. The investigation is underway as to how that person may have contracted the virus and to what extent it may have spread. But that's all we know until the investigation is further developed. Mayor Schmitz is here. Yeah, he's here.
Mayor, could you give us a sense of how your populace is handling this? I mean, what's the general mood in town about having this case be discovered?
I mean, from what I've talked to people, there's no scare or anything out there. I mean, of course, they're going to be concerned as much as anybody would, but for the most part, everybody's just taking it in stride, just like it's another day.
Why do you think that is?
I don't know. I guess I really don't know how to answer that. Why it is? I mean, we're a small town, a small knit town, and I think just people don't really get too overly concerned on things, until probably it's a more severe case than what it is. I mean, with one confirmed case at this time, and I don't know so much that most of the public probably just found out this morning. So I found out probably an hour and a half ago that it was a confirmed case. So at this time, probably a lot of people, that are at work probably don't even know it's a confirmed case yet.
Eric, let me just take a crack at it, because I think it reflects the leadership, infrastructure that are in this area that are providing excellent information to their citizens, putting things into perspective for them, being open, telling people what they know that helps Minnesotans not panic. This is one of the reasons we like Minnesota, is that given information, we will act accordingly. And the leadership that is here in this area, in this town, in this county, has been planning and preparing and thinking about how they would message and how they would get information out. And that's why I think you're seeing appropriate response in this community. It's based on the leadership that's standing behind me and the leadership that's in this community.
Doctor, there's 10 other examples they've had contact with the confirmed case?
No, we do not. I mean, those are 10. We don't know. Those are 10 specimens that have been sent in, and then we've had the investigation that's going around the confirmed case. So those, but pardon?
Are they from the middle school?
No, I don't. They're from this region, so I don't have it down to whether it's from the middle school. No, now remember, these are specimens. We only send probable ones that are highly likely or that come out in our screen. So no, these are just specimens. And remember, we've tested over 100 specimens for novel influenza, and only one has come up as confirmed.
How big is this region that you mentioned?
I know it's Stearns County and Anoka County. I don't know if it's any other counties.
Dr. Magnan, have the other family members been tested and found
so other family members of the person? Yeah. I do not know that. That's part of the investigation, is to talk.
Would that be a normal procedure in your Department of State, where you've got patient families, not that they check the other family members?
Not necessarily. Not necessarily. Depends on their symptoms and what they have done and where they have been and what they've been exposed to.
What's your advice for family members, where a family, there probably will be other families dealing with this? How should the family respond just in their own activities? Should they continue normal daily activities and take precautions and not stay home, but do normal things?
As part of your goal with this conference, why the cast not a government?
So
The folks standing here today are the community team that are going to be responsible for communicating information and leading the efforts and directing the response in the local area. So we want to make sure that we are coordinated, that we are sharing information, that we all are on the same page in terms of the plans going forward. I think that was accomplished in the meeting this morning. More broadly than just the community, Minnesota is very well prepared for this event. We have been planning to various degrees for an influenza epidemic for 10 years on a very concentrated basis. With the earlier concerns about avian flu, we've had a very concentrated planning process, including tabletop exercises and many other exercises around the planning for an influenza outbreak. The plans are in place, the infrastructure is in place, the people that you have behind me and across the state are ready for this, but it's unpredictable. And so we can't say for sure which direction this is going to head based on severity, based on the wave phenomena that the commissioner mentioned earlier. But Minnesota is as prepared as possible for this type of event.
Because of the school schedule, yes.
Yes, okay. And Esme had something?
People are reaching out to and how what kind of questions are you asking? Are you asking contact?
Exactly. So we're trying to understand what the contacts might be, who they are, where, travel, symptoms, any other things that might be related to that, to understand any kind of pattern that we can see with this input. I don't have that information. I don't have that information.
Apparently, one individual was very mild symptoms, which is apparently a pattern throughout most of the United States, especially with actual Mexican toddlers. Do you have any information on the kinds of impacting, possibly information about why the U.S. is online?
No, that's why our team of people from CDC have gone to Mexico to try to understand that situation so that we could begin to answer that. But we don't understand that at this current time. So.
Just relating back to your question, I want to underscore that. Based on what we know now, the cases in the United States, for the most part, have symptoms like seasonal flu. So we want people to understand that. It's not a situation at the current moment where if you were to contract this, it is necessarily lethal. It appears to be the equivalent of getting the seasonal flu. It's not pleasant. It still represents a significant health threat, but it is not unlike what many people get every winter.
I don't know what all the equipment is. I know it's just that we'll be getting that equipment, so I don't have any more information. If you want more, we could follow up with some lab people with that. But again, just to emphasize, we are going to see more cases. We're going to have to watch the pattern of those cases, watch the severity. There are teams of epidemiologists who are trying to understand this, and we'll communicate as soon as we know any more information about what that looks like at this time. But we are prepared as a huge system in place to be able to deal with whatever severity, whatever spread should come in this state.
I should also mention, I'm not sure the CDC is sending equipment. I think they're sending, it could be the antigens or the chemical compounds or protocols around that, so it's not necessarily hardware that they're sending up. And the broader point is they're sending all states the ability to do in-house testing now that they've got a protocol on how to do it.
Why is it 7 days? Can you talk a little more about what's going on at that time? Why?
That's based on CDC guidelines and the period of people being infectious, and so we just follow the CDC guidelines in that regard. The superintendent is undertaking, and we've recommended through the Department of Health, some just common sense cleaning. It appears that this virus can be eliminated through common disinfectant. It doesn't take any extraordinary agents in that regard. So I think the superintendent and his team are committed to do some disinfecting of commonly touched items, drinking fountains, doorknobs, handrails, things like that during that 7-day period. Yes, one more.
Question. Can you comment on the perception of Tamiflu or Melissa maybe help us ahead of exposure?
At this point, we are working on guidance for providers on that. We have to be careful about, overusing that early here. remember, this is a marathon, not a sprint, as far as thinking about how we may need to deal with this for a long period of time. So we do have Tamiflu and Relenza in our stockpile at the state. We are getting additional stockpile, so we're prepared if the severity should change. We are not recommending that people start taking it prophylactically at this point in time. We're going to continue to look at that guidance, look at guidance from CDC, but we really need to think carefully about how we use the stockpile that we have if we're in for a longer period of time with it. But we are in the process of strategically placing some of that stockpile out in the community, in regions, so that it will be readily accessible in case the situation changes.
And we're also going to need the cooperation of the healthcare community and the health providers to use the Tamiflu and the Relenza under this guidance and be careful about how and when they dispense it according to the guidance.